Well, good morning, everyone. And today, the government of Saskatchewan and the Saskatchewan Health Authority have made the decision to send 6 of our ICU patients out to Ontario. This is being done to ensure that they continue to receive the very best possible care available. While the quality of care patients receive in Saskatchewan has been and it continues to be excellent, and that is thanks to our dedicated and professional health care workers here in the province, the current level of pressure that our ICU staff requires that a few patients be sent out of the province to relieve some of that current pressure that we have. We will also today be asking for additional resources from the federal government, staff that can work in our ICU settings. And while we appreciate any help that the federal government can provide, we are also quite realistic and that this will likely not be a large number of staff, but it will be a very specialized grouping of staff that will be required. I want to take this opportunity to thank the province of Ontario, the government of Ontario, and the people of Ontario for assisting Saskatchewan in our time of need. Just as Saskatchewan has assisted other provinces in the past during their times of need. It's one of the great things about this country. And of course, I want to take this opportunity to thank all of the physicians, the nurses, and the other healthcare professionals that are working not only in our ICUs in Saskatchewan, but also in every other part of the healthcare system across this province and across the nation. At this point, COVID continues to be largely a pandemic of the unvaccinated. When vaccination rates go up, COVID rates decrease. And that has started to happen over the course of the past few weeks in Saskatchewan. A lot more people have made the decision to get vaccinated over the course of the past month or so since we announced the new proof of vaccination or proof of negative test requirement in our businesses, in our public service, and in many workplaces across the province. In fact, over 100,000 vaccines have been delivered in the last month. And so we are starting to see the impact of that on our case numbers. Our 7-day case average of new cases is down about 30%. Over the course since that announcement was made. The active cases are now about 25% of their peak back in September, and that was just after the new proof of vaccination policy was announced, as well as the masking order. I think you'll see those numbers continue to drop in the days and weeks ahead. However, we still have too many people who are unvaccinated in the province, and if you look at the regions with the lowest vaccination rates, they also have some of the highest case rates in the province as well. So there's a very clear and quite simple way for us to fix that, and that is for even more people in Saskatchewan to go out and get vaccinated to increase their immunity. While case rates have been falling, hospitalizations and ICU admissions will lag behind those falling case trajectories. Usually trend by somewhere between 2 to 4 weeks, which is why we have made the decision today to begin sending some of our patients out of the province. It's to ensure that those patients continue to receive the very best possible care that they can, and to relieve some of the pressures that we currently have on our healthcare system in the short term today in Saskatchewan. So with that, I'd take any questions. Oh, you know what? That would be a question for our emergency operations center, which I think you'll be briefed with shortly. Right now, what we're doing is we're moving 6 patients out over the course of the next 3 days to alleviate some of the short-term pressure that we have in our intensive care units here in Saskatchewan. That alongside with the the expansion of our intensive care staff due to a number of slowdowns that have occurred throughout the healthcare system. We're very hopeful that will be sufficient in the days ahead. But as we know with COVID, it's been a very challenging virus for across Canada and around the world. We've seen in months gone by where other provinces have had to make very difficult decisions, like Saskatchewan is here today. That's why we implemented a number of measures just over a month ago now. Those measures are proving to be effective, and we will eventually prove to be effective with our ICU cases as well. But our cases are down. Our actual hospitalization admissions have decreased over the course of the last 10 days, but our ICUs are the lagging factor, and they continue to remain just too high here in Saskatchewan, and that's precipitated today's decision. So six are moving here over the course of the next 3 days, and we'll reassess as we find our way through the week.
Why did it take this government over 2 hours to confirm the news to the Saskatchewan media after Ontario media had already reported this? And where did that directive come from to not confirm this news with media despite us reaching out for hours?
Well, I don't know what information has come out of Ontario, but I think Saskatchewan has been very transparent in the fact that we've been having discussions not only with Ontario but with Manitoba, with Alberta, as well as to, do they have some capacity should we find ourselves in a situation to have to move some of our patients out of the province. So the decision has been being planned for a number of days, and I think we indicated that as throughout last week, up to and including close to the weekend. But the decision to actually move patients, I don't think has been confirmed until this morning from Saskatchewan's perspective. So if anyone was confirming that previous to that, that would be news to myself. But the planning for this, should it be needed, has been going on for a number of days. We've been very transparent with that.
I'm talking about this morning when they confirmed it. We had reached out to the Saskatchewan Health Authority.
Who confirmed it?
The critical care doctor for the critical care command center in Ontario.
Oh, okay. Which doctor?
Dr. Michael.
Okay. Well, I'm out here today. I'm confirming it with you now that we are moving 6 patients to Ontario.
Ontario time as well, or because we were asking for this information and we were not provided it. These are our community members, these are our neighbors, these are our family and friends, and they are not hearing it from the Saskatchewan government at first. They are hearing it from Ontario news outlets and Ontario doctors.
No, I think they're hearing it from the Premier of Saskatchewan right now as I'm out here talking to Saskatchewan people through our news outlets here, that we are in the process now of officially moving 6 of our patients into hospitals in Ontario to preserve the quality of care the highest quality of care that we know is available. They've been receiving that in Saskatchewan, and now, unfortunately, due to the pressures that we have in our ICU departments, has been a decision that has been worked on for a number of days now, finalized here this morning, to move those patients out, starting with, I believe, 1 today, 6 over the next 2 to 3 days. And then we will look at where our capacity is and what our situation looks like here in Saskatchewan. This is not unique to Saskatchewan throughout COVID, and I would say over the past number of years, there's been a number of reasons where we have actually accepted people from other jurisdictions across Canada, whether it be due to wildfire. There was a number of people from Ontario that we housed here in Saskatchewan a couple of years ago due to wildfire, and this is what really, I think, underscores the greatness of Canada, our ability to support one another when it's needed.
Saskatchewan is the only province doing this right now, so why do you think that is, and could this have been avoided?
Well, we have always said that the decisions that we make ultimately are there to preserve the hospital capacity that we have. Just over a month ago, we had come out with some fairly significant, quite significant public health measures. We reintroduced the masking mandate and to move forward, one of the earliest provinces to move forward operationally with the proof of vaccination policy, which did come into effect on October the 1st, and I think is proving to be effective with over 100,000 vaccines that have been delivered since that point. So, if the question is in the measures that we have in place are proving to be working, our numbers are coming down. We're down about 30% month over month. If the question is, should we have moved a week or possibly 10 days earlier with that policy, that's a fair question. That is a fair question. Our numbers, but as we sit here today, our numbers are reducing. Our hospitalizations have reduced the last 10 days, but our intensive care numbers continue to be high, and that's what's precipitating today's decision.
So just one more for me. Do you anticipate having to send more patients to Manitoba or Ontario in the next few weeks, or is this maybe just a one-time thing because the numbers are so high at this point? You're saying that you may see these numbers drop, but case numbers are going down next a lot.
Yeah, I think we'll reassess as the week goes on. I think the conversations with respect to who has capacity and where that capacity will continue as they were transpiring last week, so that everybody is aware. And the provincial, our operations center, led by Marlo Reynolds, Scott Livingston, and Max Hendricks, have been in constant contact not only with the federal government but other jurisdictions as to what resources are available for today. A province like Saskatchewan. A few months ago, it was other provinces, and who knows who it'll be in the weeks ahead. To ensure that we're collaborating with our Canadian resources to serve the people of Canada, and in this case, the people of Saskatchewan, as best we can. So the conversations will continue, and it'll be reassessed, likely on a daily basis, Adam, to your point, as to what the capacity is here, what our ICU capacity is, and how are we utilizing every provincial resource, which I'm assured here this morning we are. Well, my answer would be it's a good thing we did act on the measures, significant public health measures where we did. It is a fair question. Should have we, possibly move forward? And people often say, is there things you would have changed in your response to this pandemic? Potentially we could have moved possibly a week sooner with the masking mandate, or maybe even sooner with the proof of vaccination policy that we had brought in place. Even, with the proof of vaccination policy is the policy that actually does have some longer-term effects in driving our case numbers down in a more permanent nature. The masking policy, other public health measures are a temporary stopgap to buy us some time and ease some of the pressures that we might have in our ICUs. That's why we moved on it immediately, just over a month ago. But we were, I would say, one of the earliest provinces to operationally put in place the proof of vaccination policy. There's a number of announcements that were made, but we were up and running October the 1st, and it is proving to be effective, as it has increased our vaccination rates substantially.
Sending people to another province from the ICU seems to kind of have Saskatchewan entering a new level of seriousness almost in the pandemic. So what kind of responsibility do you and your government take for this being able to get to this point?
For which, sorry?
For the pandemic being able to get to this point in Saskatchewan where we're sending people out of province?
Well, the pandemic's been at similar levels at virtually every province across Canada at various times. We just have seen Alberta come through, and their trajectory is in a much better area today, as their numbers are declining and their hospitalizations are declining. But we've seen COVID challenge virtually every area of Canada, up to and including our territories throughout the north. Saskatchewan is going through a challenge right now. We have a number of communities across this province that have quite frankly, let's call it what it is, far too low of a vaccination rate. We're continuing to work through our Saskatchewan Health Authority, through community leaders, on how can we continue to increase that vaccination rate by working with individuals, making vaccines available, and yes, introducing a very ambitious proof of vaccination program, so that, as I had said numerous times for months now, life is going to be more uncomfortable for the unvaccinated in Saskatchewan. It's unfortunate that is where we're at, but that is where we're at, and that's why we introduced the policy that we have. And it is increasing our vaccination rates. It needs to increase them even more, as that ultimately is going to be our path to lower hospitalization rates, which is guiding our decisions, always has and will continue to throughout this pandemic. The government has been, closely aligned with our Chief Medical Health Officer, with Scott Livingston, with the Saskatchewan Health Authority, and now with our Provincial Emergency Operations Centre, in making decisions throughout this pandemic. And so that's why I say, with respect to the significant public health measures that we had put in place, should have we moved a week earlier? Potentially we should have. Make which decision?
To ask for federal help and to send patients out there. Because as you said, ICU partly, cases were being considered. So I'm wondering why at that point, when we knew that this was likely to happen, likely to be the stage that we're at today,
Right. Well, if you go back about a month as well, we were looking, and it was indicated to the government and to Saskatchewan people as well, that our operational capacity, our ICU level in the province was going to flex with the first slowdown up to 125 beds, second slowdown up to 175 beds. We've been unable to achieve that 175 bed ICU capacity. We have stretched since the Emergency Operations Center came into play. We have stretched another 10 beds up to 135 beds in our ICU capacity, and so we aren't able to attain what we felt we were going to be able to attain here in the province. But we did move a month ago with the public health measures that we have, which are working. Our numbers are down about 30% since September the 20th, about a month over month, which is where we ultimately peaked. Over the course of the past week, to answer your question specifically on the ask of the federal government, those discussions have been going on, not only with the federal government, with other provinces, as to what capacity do we have in human resource capacity and actual bed capacity. And so the request will be going to the federal government here shortly for today for very specialized number of people that can support our current ICU operations here. We're also very realistic in what the federal government has provided other areas and what they might be able to provide Saskatchewan. It'll be 2, 3, 4, 5 ICU beds, which isn't a lot in the scope of 135, but it very much will be appreciated as every bed does count right now.
Did you receive any advice either a week ago, 2 weeks ago, or at any point during the current surge to make these two decisions, and now answer from Dr. Shaw or any other doctor?
Well, when we've been transparent with this, the ask is coming today. The discussions have been occurring for likely a week or better. Pardon me? Well, I talked to the Prime Minister about it on our phone call. The Provincial Emergency Operations Center has been in discussions with the Federal Operations Center. The Minister of Health has been talking with his counterparts, not only federally but provincially as well. And so I would say, the conversations have been happening at all levels. What we are seeing here today is the ultimate decision, and this morning is when that decision was made, ultimately to move. And the preparations have been in place, but to ultimately move 6 patients to Ontario here today, and to make a request, an official request for some numbers with the federal government, so that they can hopefully support, a number of ICU beds, additional ICU beds here in Saskatchewan. That should, if our current trajectory of decrease in numbers, ultimately decrease in hospitalizations, we're hopeful in the weeks ahead that we would again be able to get to a more manageable place within our healthcare system for those that use it, but also for those that are working in it.
When will this help be arriving in Saskatchewan?
The federal help?
Yeah.
Well, there's a turnaround, and this would be a good question for the Emergency Operations Center as well, because I think they're available this morning. But usually, we're looking at less than a week turnaround. Hopefully 4 to 5 days would be the turnaround. Again, it isn't a large number of people, but we're hopeful that it would open up, 2, 3, 4, 5 emergency beds. Every bed is, very, very useful right now, and would prevent us from moving folks out of province. I'd be clear too. We still do have a emergency intensive care unit capacity. We still do have beds that are available, and we need to ensure that we do have a buffer of beds should there be something substantial that happens in the province, and that we can offer those services. And so this will ensure that we can provide the quality of care, in this case to these 6 individuals, but ensure that we also continue to have that buffer capacity here in the province should we have a major event that requires that additional care. Okay.
And I'm wondering if in the past you've obviously sometimes interfered in order to preserve uniformity across the province.
Right.
I'm wondering if you again have any intention of moving to quash that.
Yeah, I wasn't aware of this. I suppose my just initial thought would be any municipality can implement gathering limits, whatever measures they feel are necessary within the property that they own and the facilities that they operate, which in this case would be quite frankly most of the gatherings that occur, whether they be in hockey arenas, whether they be in venues that are owned municipally. That's all I would say at this point. Is this is the first I'm hearing of it.
We've heard you say it multiple times that the federal government
Yeah.
they can actually provide.
Well, when I made a comment a week or two ago, I was taking essentially a per capita off of what was provided to Alberta.
So they tell you they're only can send two.
Pardon me?
They didn't tell you then you can only send two personnel to help.
Who did they tell? Who told me? The federal government?
The federal government, anyone from the federal government. I'm just kind of wondering.
No, there's, you know what, and this would be a good question as well for the operations center, as there have been in the preparation for the ask today, there have been many discussions on, you know, what type of capacity would the federal government, other provinces as well, but the federal government haven't actually providing, you know, providing the specialized staff that we need, the respirologists, the critical care nurses that are there. And there's two sources that the federal government can look to. One is some military nurses and staff that they have, and then through the Red Cross as well. What they did in Alberta was, my understanding, was provided for, you know, a small number of beds, enough staff to outfit a small number of beds. I believe it was less than 5. We're hopeful that we could get into that neighborhood as well, and that's where my comments come today. As we see Alberta, the numbers are starting to trend down, the hospitalizations are starting to trend down, and we're hopeful that some of the staffing that Alberta had would be able to be transitioned over to Saskatchewan, utilized here. And if we could have, you know, 2 to 5 additional ICU beds, that would be very helpful.
So no one from the federal government actually said to this government that they only can provide 2 to 5.
There is a certain pool that is available, and that question would be for Marlo with the emergency center, that's where those discussions have been occurring. Pardon me?
Why did you say it if you know we don't really know how much personnel they can help us with?
But there are certain pools that are available, and I would encourage you to ask Marlo that, and he can speak to the specifics of what is available in those certain pools. I've been advised that it'd be in the neighborhood of 3 to 5 ICU beds. Okay.
Are there a couple last questions?
Yeah.
Are there currently any patient transfers pending at this time other than those 6?
Yeah, no, those 6 would be the ones that are relative to COVID. I mean, there are patients that will access care outside of the province as well on a regular basis for various operations, things of that nature. But this is the 6 that we're looking to transfer earlier this week, and then regroup, reassess as the week goes on. Sorry?
Does this have any impact on triage at this time?
Again, that would be a question for Scott Livingston. You know what we have been briefed on, the health minister and myself, as recent as this morning, is this will you know, free up some of the resources that we have that have been stretched you know, oh so very far in our ICU centers.
What do you have to say to the families of these patients that now, I mean, they already can't see their family members, they're worried now, they have to worry from across the country.
Yeah.
And what do you have to say to them if they might think that, you know, this action is a result of maybe mismanagement?
Yeah. Yeah, no. What I would say is, you know, this is a decision that is being made to ensure that we can, you know, offer the highest quality care that we can to all Saskatchewan residents, including the 6 that we're going to transfer out in the next few days to Ontario. We'll be working with the families on a case-by-case basis, so that they can have 1, possibly 2 family members that will be able to join and support them as well, to ensure that this, you know, those families supporting folks are able to, you know, be in the vicinity or be near their loved ones as we go through this. So to the family members, this ensures that everyone, including their family member, will receive the highest quality care, and we're going to work with them so that there can be family supports near them.
Do you know how much it's going to cost to send a patient out of province?
No, I don't know that number. No, but it isn't. You know, moving patients in and out of Saskatchewan, moving people across Canada during whether it be a wildfire, whether it be a flood, or whether it be a COVID pandemic, it does occur. Saskatchewan often has received folks that have been displaced from other areas, up to and including the more recently in the last number of months in the COVID pandemic. We'd taken, I believe, some folks from Manitoba and from Ontario earlier in the pandemic, but we often have taken folks for other reasons as well, housed them at our dormitories in the summer, at the U of R, at the U of S and other areas. So I don't know what the exact cost of that would be for these 6 folks and their potentially their family members, but it'd be minimal, I think, in the what the cost of COVID is to the nation for sure.
Well, I have any questions for Dr. Shaw about digital restrictions in this 11 a.m. press conference. I'm wondering at this time what your thoughts are on restrictions like gathering restrictions or asking school admissions to move classes
Yeah. So the we have substantial public health measures in place here today, and if you if you go back through over the course of this pandemic, for the first almost a year, that was the only tool we had to have any impact on COVID numbers was public health measures, and we took action with those public health measures when it was required to preserve the capacity in our healthcare system. Since the turn of the calendar year, we've had an increasing availability of vaccines, which have proven to be the most effective public health measure against COVID-19. And again, we encourage as many as possible to go out and get vaccinated here in Saskatchewan. Now we're augmenting that with other tools that are becoming available today and in the weeks ahead. One is the availability of self-testing kits, self-rapid testing kits, of which we're going to be making available in the next number of days as well across the province, so that folks can have access to a much quicker and much simpler testing device should they feel they need that. We're also moving, as I'd said earlier, on additional early intervention treatments that have recently become available from Health Canada. We're moving to make those available to Saskatchewan people, all with an effort and a goal to reduce the number of people that are coming into our hospital system. Whatever tool we have that can reduce the number of people that are ending up in hospital, we're interested in looking at. And that's why we have today a significant number of public health measures that are in place. We talked about the timing and should have the government moved a week sooner on that, and that's a fair question. But there are significant public health measures that are in place today, and they are working. Our vaccination rates are increasing, and our case numbers are decreasing.
Last question. Yeah. Why were you so reticent before to ask for federal help? Like, what is or wasn't announced?
I don't think anyone was reticent about asking for federal help. What we were doing through our emergency operations center that was just up and running was looking inward as to what resources do we have to increase our ICU capacity here, and we have increased it by about 10 beds over the course of when that emergency operations center came into play. Through Marlo Reynolds, he was reaching out through his contacts as to what other jurisdictions had for capacity if we needed to transfer some patients out like we do here today. Ultimately, do they have any ability to provide some of the very specialized critical care nurses, respirologists, things of that nature to Saskatchewan, of which provinces quite obviously don't, and what capacity the federal government as well would have to provide some of this very specialized these very specialized disciplines that we do require to support our current ICU beds as well as any additional ICU beds. So there was nothing, there was no one being reticent about making that request. It was about structuring that request so that with all of the partners, including our Saskatchewan Operations Centre, to essentially bring it forward like we are here today. In the meantime, our ICU numbers have increased over the course of the last week as well. We're seeing our hospitalization numbers start to decrease, but our ICU numbers are continuing to increase, and that ultimately has precipitated the decisions that were made today, well planned for, well discussed, but ultimately made today to make the request to the federal government, but also move out 6 of our patients, our Saskatchewan patients, to Ontario.